So this is a work that I did with Dr. Courtney DiNardo, who is the mentor for this project. So recently, the ELN 2022 has included patients with newly diagnosed AML who have splicing gene mutations in the adverse risk category. So we are showing actually that when these patients receive Venetoclax-based intensive or low-intensity therapy, that the prognostic impact of splicing factor gene mutations are abrogated. So we are looking in a retrospective fashion around 1,000 patients who presented to MD Anderson over the last 5 years with newly diagnosed AML and comparing the outcomes of patients with splicing factor gene mutations with those who are wild type. So around a fourth of patients had splicing factor gene mutations. In the analysis, we included the intensity of the therapy they received with or without Venetoclax, the other AML prognostic factors like age, time point of presentation, the AML genomics, and the erstwhile ELN risk stratification, and we are comparing their outcomes. So both in the overall group, and then when we segregate them based on whether they were de novo or secondary therapy related, whether they received low intensity or high intensity or intensive therapy, or they were high risk ELN adverse risk or intermediate ELN adverse risk, we see that by themselves, the splicing factor gene mutations do not affect both the response rates as well as the overall survival.